Question 1. What is the most important step a dental assistant should take before beginning instrument sterilization to ensure effective pathogen killing? A. Load the sterilizer to its maximum capacity. B. Visually inspect instruments for sharpness. C. Thoroughly clean and rinse all instruments to remove debris. D. Place instruments directly into sterile pouches. Answer: C. Thoroughly clean and rinse all instruments to remove debris. This question tests your critical knowledge of instrument reprocessing, specifically the essential preliminary step before sterilization. The keywords most important step before beginning instrument sterilization and ensure effective pathogen killing highlight the necessity of proper pre-cleaning. Sterilization cannot be achieved if instruments are covered in blood, saliva, or tissue, as these organic materials can shield microorganisms from the sterilizing agent. Therefore, thoroughly cleaning and rinsing instruments to remove all visible and microscopic debris is paramount for sterilization to be successful. For example, instruments must go through the ultrasonic cleaner or instrument washer to remove all bioburden before being packaged for the autoclave. Always remember that cleaning is the crucial first step for effective sterilization. Question 2. In the universal numbering system, which permanent tooth is designated as number 19? A. Maxillary left third molar. B. Mandibular left first molar. C. Mandibular right second premolar. D. Maxillary right second molar. Answer: B. Mandibular left first molar. This question tests your foundational knowledge of tooth identification using the universal numbering system, which is widely used in the United States. The keyword permanent tooth is designated as number 19 requires precise recall of the numbering sequence. In the universal system, permanent teeth are numbered 1 to 32, starting with the maxillary right third molar, number 1, moving across the upper arch to the maxillary left third molar, number 16, then dropping to the mandibular left third molar, number 17, and continuing across the lower arch to the mandibular right third molar, number 32. Therefore, number 19 represents the permanent mandibular left first molar. Accurate tooth identification is essential for proper charting and communication in the dental office. Always remember that number 19 is your mandibular left first molar. Question 3. What is the primary purpose of a lead apron with a thyroid collar during dental radiography? A. To protect the X-ray tube from overheating. B. To reduce scatter radiation in the dental operatory. C. To shield the patient's radiosensitive organs from unnecessary radiation. D. To assist the dental assistant in positioning the film. Answer: C. To shield the patient's radiosensitive organs from unnecessary radiation. This question assesses your fundamental knowledge of radiation safety. The keywords primary purpose of a lead apron with a thyroid collar highlight its protective function. The lead apron is designed to minimize radiation exposure to the patient's radiosensitive tissues, particularly the reproductive organs, and the thyroid collar specifically shields the thyroid gland. This is a crucial step in adhering to the ALARA, as low as reasonably achievable, principle, ensuring patient safety during X-ray procedures. It does not protect the X-ray tube, reduce scatter in the room, collimation does this, or aid in film positioning. Always remember that the lead apron and thyroid collar are essential for protecting the patient from unnecessary radiation exposure. Question 4. What is the most reliable method for monitoring the effectiveness of a dental sterilizer, autoclave? A. External chemical indicators, e.g., tape. B. Internal chemical indicators, e.g., strips inside packages. C. Biological indicators, spore tests. D. Checking the temperature and pressure gauges on the sterilizer. Answer: C. Biological indicators, spore tests. This question tests your critical knowledge of infection control, specifically sterilizer monitoring. The keywords most reliable method and monitoring the effectiveness of a dental sterilizer are definitive clues. Biological indicators, also known as spore tests, are considered the gold standard and most reliable method for monitoring sterilization effectiveness. They contain highly resistant bacterial spores that are challenged during the sterilization cycle. If the spores are killed, it indicates that the sterilizer achieved the necessary conditions to kill all pathogens, including the most resistant ones. Chemical indicators and gauges only confirm exposure to conditions, not the actual killing of spores. Always remember that biological indicators, spore tests, are the ultimate proof that your sterilizer is working correctly. Question 5. When mixing irreversible hydrocolloid impression material, alginate, what effect will using water that is too warm have on the setting time? A. It will have no effect on the setting time. B. It will increase the setting time, making it set slower. C. It will decrease the setting time, making it set faster. D. It will cause the material to become brittle. Answer: C. It will decrease the setting time, making it set faster. This question tests your practical knowledge of dental materials, specifically alginate manipulation. The keyword water that is too warm and effect on the setting time are crucial. The chemical reaction that causes alginate to set is temperature sensitive. Using water that is too warm will accelerate this chemical reaction, causing the alginate to set much faster than intended, which can make it difficult to mix properly and take an accurate impression. Conversely, cold water will extend the setting time. For example, if you use warm tap water instead of room temperature water, the alginate might start to harden in the bowl before you even get it to the patient's mouth. Always remember that warmer water makes alginate set faster. Question 6. Which method of anxiety reduction provides a conscious state, allows the patient to respond to verbal commands, and has a rapid onset and recovery? A. General anesthesia. B. Oral sedation. C. Nitrous oxide/oxygen sedation. D. Intravenous, 4, sedation. Answer: C. Nitrous oxide/oxygen sedation. This question tests your understanding of various patient management techniques, specifically forms of sedation. The keywords anxiety reduction, conscious state, respond to verbal commands, and rapid onset and recovery are definitive clues for nitrous oxide/oxygen sedation, commonly known as laughing gas. Nitrous oxide provides a relaxed, conscious state where the patient remains communicative, and its effects can be quickly reversed simply by having the patient breathe pure oxygen. Oral and 4 sedation often have a slower onset and longer recovery, while general anesthesia renders the patient unconscious. For example, a nervous child might be given nitrous oxide to help them relax during a filling, and they'll be back to normal quickly after the procedure. Always remember that nitrous oxide offers a quick, conscious way to ease patient anxiety. Question 7. Which instrument is used to measure the depth of periodontal pockets and assess the gingival health? A. Dental explorer. B. Cotton forceps. C. Periodontal probe. D. Amalgam carrier. Answer: C. Periodontal probe. This question tests your foundational knowledge of dental instruments. The keywords measure the depth of periodontal pockets and assess the gingival health are definitive clues. A periodontal probe is a slender, calibrated, marked with measurements, instrument specifically designed to gently measure the depth of the gingival sulcus, the space around the tooth, or periodontal pockets. These measurements are crucial indicators of periodontal health or disease. A dental explorer detects caries, cotton forceps grasp small items, and an amalgam carrier places filling material. For example, during a gum exam, the hygienist uses the probe to call out numbers, like 233, around each tooth to check for healthy gum depths. Always remember that the periodontal probe is for measuring gum pockets. Question 8. In the context of infection control, what does standard precautions mean in a dental office? A. Treating only patients with known infectious diseases as contagious. B. Assuming all blood and body fluids are potentially infectious. C. Using sterile gloves for all patient interactions. D. Disinfecting all instruments after use, regardless of patient risk. Answer: B. Assuming all blood and body fluids are potentially infectious. This question tests your critical knowledge of fundamental infection control principles. The keyword standard precautions is crucial. Standard precautions are a set of infection control practices that healthcare personnel apply to all patients, regardless of their known or presumed infectious status. The core principle is to assume that all blood, body fluids, excluding sweat, non-intact skin, and mucous membranes are potentially infectious. This approach aims to prevent the transmission of microorganisms from both recognized and unrecognized sources of infection. It doesn't mean only treating known contagious patients or using sterile gloves for everything. Always remember that standard precautions mean treating everyone as if they could transmit infection to protect yourself and others. Question 9. When considering a direct pulp cap, which material is generally preferred due to its ability to stimulate dentin bridge formation and its biocompatibility? A. Zinc phosphate cement. B. Composite resin. C. Mineral trioxide aggregate, MTA. D. Zinc oxide eugenol, ZOE. Answer: C. Mineral trioxide aggregate, MTA. This question delves into advanced endodontic materials and their specific applications. The keywords direct pulp cap, generally preferred, and ability to stimulate dentin bridge formation and its biocompatibility are definitive clues for mineral trioxide aggregate, MTA. MTA is a highly biocompatible material that is widely used and considered superior for direct pulp capping. It promotes the formation of a dentin bridge over the exposed pulp, effectively sealing and protecting it, and has excellent sealing properties. While calcium hydroxide, not an option here, also stimulates dentin, MTA is often preferred for its sealing and long-term stability. The other materials are not primarily used for this specific biological response. Always remember that MTA is the advanced material used to help the pulp heal and form a protective dentin layer. Question 10. When handling a light curing unit, what is the primary safety precaution for the dental assistant's eyes? A. Avoid looking directly at the light tip. B. Use a light-blocking shield or orange-tinted glasses. C. Close eyes completely during curing. D. Ensure the patient is wearing safety glasses. Answer: B. Use a light-blocking shield or orange-tinted glasses. This question tests your critical knowledge of safety protocols when working with light-cured materials. The keyword primary safety precaution for the dental assistant's eyes highlights the direct protection needed. Curing lights emit high-intensity blue light that, with prolonged or repeated exposure, can cause retinal damage to the dental assistant's eyes. Therefore, using appropriate eye protection, shields or orange-tinted glasses, is essential to filter out this harmful wavelength and protect vision. While avoiding direct gaze and ensuring patient protection are also important, wearing certified eye protection is the primary personal safety measure. Always remember that certified light-blocking eyewear is crucial to protect your eyes from the curing light's intense blue light. Question 11. Which term describes the gradual loss of tooth structure due to clenching or grinding teeth, bruxism? A. Erosion. B. Abrasion. C. Attrition. D. Abfraction. Answer: C. Attrition. This question tests your foundational knowledge of tooth wear processes. The keyword gradual loss of tooth structure due to clenching or grinding teeth Bruxism specifically defines attrition. Attrition is the physiological or pathological wearing away of tooth structure as a result of tooth-to-tooth contact, such as during chewing, but primarily due to parafunctional habits like bruxism, grinding. Erosion is chemical wear, abrasion is mechanical wear from foreign objects, like aggressive brushing, and abfraction is caused by bending forces at the gum line. For example, a patient who grinds their teeth heavily might show flat spots on the chewing surfaces of their molars from attrition. Always remember that attrition is wear from teeth rubbing against other teeth. Question 12. What is the primary advantage of using a digital radiography system compared to traditional film-based radiography? A. Higher initial equipment cost. B. Longer processing time. C. Reduced patient radiation exposure. D. Requires chemical processing. Answer: C. Reduced patient radiation exposure. This question assesses your comprehensive understanding of radiography technology. The keywords primary advantage and digital radiography system compared to traditional film-based radiography highlight a major benefit. Digital sensors are significantly more sensitive to X-rays than film, meaning they require a much lower radiation dose, often 50 to 90% less, to produce a diagnostic image. This reduction in patient radiation exposure is a key advantage for patient safety. While digital systems have other benefits like instant images and no chemicals, reduced radiation is paramount. Always remember that digital X-rays mean significantly less radiation for the patient, which is a huge plus for safety. Question 13. Penicillin and amoxicillin belong to which class of antibiotics? A. Macrolides. B. Cephalosporins. C. Beta-lactams. D. Fluoroquinolones. Answer: C. Beta-lactams. This question tests your foundational knowledge of antibiotic classifications, which is important for understanding patient allergies and prophylactic regimens. The keywords penicillin and amoxicillin and class of antibiotics are crucial. Penicillin and amoxicillin are both well-known antibiotics that belong to the beta-lactam class of drugs. They work by inhibiting bacterial cell wall synthesis, and their shared chemical structure, the beta-lactam ring, is why patients allergic to penicillin may also be allergic to other drugs in this class, and sometimes cephalosporins as well. Macrolides, cephalosporins, and fluoroquinolones are different classes of antibiotics. Always remember that penicillin and amoxicillin are part of the beta-lactam family of antibiotics. Question 14. What is the main characteristic of a localized allergic reaction, e.g., to latex gloves, that differentiates it from a systemic anaphylactic reaction? A. Difficulty breathing and swelling throughout the body. B. It only affects the area of direct contact. C. Rapid onset of symptoms within seconds. D. Severe drop in blood pressure. Answer: B. It only affects the area of direct contact. This question tests your critical ability to differentiate types of allergic reactions. The keywords main characteristic of a localized allergic reaction and differentiates it from a systemic anaphylactic reaction are crucial. A localized allergic reaction, such as contact dermatitis to latex gloves, primarily affects only the area of direct contact, causing redness, itching, or rash confined to that specific spot. A systemic, anaphylactic reaction is a severe, life-threatening response involving multiple body systems, characterized by widespread swelling, difficulty breathing, and a significant drop in blood pressure. Understanding this difference is vital for appropriate emergency response. For example, if a patient gets a rash only where their latex gloves touch their skin, that's a localized reaction. Always remember that localized reactions stay in one spot, unlike a body-wide systemic reaction. Question 15. The purpose of a matrix system, e.g., Toffelmeier retainer with a band, for a Class II restoration is primarily to A. Provide proper light reflection for the dentist. B. Prevent polymerization shrinkage of the composite. C. Replace the missing proximal wall and allow for proper contouring of the restorative material. D. Retract the cheek and tongue for better access. Answer: C. Replace the missing proximal wall and allow for proper contouring of the restorative material. This question tests your fundamental understanding of restorative procedures and the role of matrix systems. The keywords purpose of a matrix system, e.g., Toffelmeyer retainer with a band, and Class II restoration are crucial. A Class II restoration involves a missing proximal, side, wall of a posterior tooth. The matrix system's primary purpose is to temporarily replace this missing wall, creating a form against which the restorative material, amalgam or composite, can be condensed or placed. This allows for proper anatomical contour, a tight contact point with the adjacent tooth, and prevention of material extrusion. It is not for light reflection, shrinkage control, or tissue retraction. For example, when filling a cavity on the side of a back tooth, the matrix band creates the new wall so the filling can be packed into shape. Always remember that the matrix system builds the missing side wall of the tooth. Question 16. What is the normal reading range for an adult patient's systolic blood pressure? A. Below 90 mm of mercury. B. 90 to 120 mm of mercury. C. 120 to 140 mm of mercury. D. Above 140 mm of mercury. Answer: B. 90 to 120 mm of mercury. This question assesses your essential knowledge of vital signs, a fundamental aspect of patient assessment. The keyword normal reading range for an adult patient's systolic blood pressure refers to a standard physiological parameter. A healthy adult's systolic blood pressure, the top number, indicating pressure when the heart beats, typically falls within the range of 90 to 120 mm of mercury. Readings outside this range, especially if consistently elevated, can indicate hypertension, high blood pressure, or hypotension, low blood pressure, and may require medical attention. For example, a blood pressure reading of 110/70 mmHg would show a healthy systolic pressure. Always remember that 90 to 120 mm of mercury is the normal range for systolic blood pressure. Question 17. The primary reason for using a temporary material, e.g., intermediate restorative material, IRM, to seal an endodontic access opening between appointments is to A. Stimulate pulp healing. B. Provide a permanent seal for the canal. C. Prevent microleakage and contamination of the root canal system. D. Increase the strength of the tooth structure. Answer: C. Prevent microleakage and contamination of the root canal system. This question tests your specialized knowledge of endodontic procedures and material uses. The keywords primary reason for using a temporary material, IRM, to seal an endodontic access opening between appointments are crucial. During root canal treatment, the access opening in the crown of the tooth is sealed with a temporary restorative material like IRM, intermediate restorative material, between appointments. This is critically important to prevent bacteria and saliva from re-entering the disinfected root canal system, microleakage, and contaminating it, which could lead to treatment failure. It is not for pulp healing, permanent sealing, or strengthening the tooth. For example, after the first root canal visit, the dentist will place a temporary filling to protect the inside of the tooth until the next appointment. Always remember that temporary fillings in endo are all about protecting the canal from contamination. Question 18. Which type of impression material sets by a chemical reaction and cannot be reversed by heating? A. Reversible hydrocolloid. B. Agar. C. Alginate. D. Thermoplastic wax. Answer: C. Alginate. This question tests your fundamental knowledge of impression material classification. The keywords "sets by a chemical reaction" and "cannot be reversed by heating" are definitive clues for an irreversible impression material. Alginate is a prime example of an irreversible hydrocolloid. Once the powder and water are mixed, a chemical reaction occurs that causes it to set into a gel, and this process cannot be undone by heat. Reversible hydrocolloid, agar, and thermoplastic wax can be softened by heat and reused. For example, once the alginate impression is taken and set in the patient's mouth, it's a solid, one-time use material. Always remember that alginate is irreversible because its setting is a one-way chemical change. Question 19. The purpose of using articulating paper after placing a new restoration is to A. Polish the restoration to a smooth finish. B. Check for proper interproximal contact. C. Evaluate and adjust the occlusal contacts, bite. D. Apply a bonding agent to the restoration surface. Answer: C. Evaluate and adjust the occlusal contacts, bite. This question tests your practical knowledge of restorative procedures and the use of common dental materials. The keyword "purpose of using articulating paper after placing a new restoration" is crucial. Articulating paper is a thin, colored paper used to check the patient's bite. When the patient bites down on it, it leaves marks on the new restoration and opposing tooth, wherever there are contact points. This allows the dentist to identify and adjust any high spots, ensuring a balanced and comfortable occlusion, bite, and preventing premature wear or fracture of the new restoration or the opposing tooth. It is not for polishing, checking interproximal contact, that's floss, or bonding. For example, after placing a composite filling, the dentist will have the patient bite on the blue paper to ensure the filling isn't high in their bite. Always remember that articulating paper is all about perfecting the bite after a filling. Question 20. When developing dental X-ray film manually, what is the first solution the film is immersed in? A. Fixer. B. Water, rinse. C. Developer. D. Distilled water, final rinse. Answer: C. Developer. This question tests your fundamental knowledge of manual film processing steps in radiography. The keyword "first solution the film is immersed in" is crucial. During manual processing, the exposed dental film is first placed into the developer solution. The developer initiates the chemical reaction that converts the exposed silver halide crystals into metallic silver, creating the latent, invisible, image visible on the film. After the developer, the film is rinsed, then placed in the fixer. For example, once an X-ray film is taken, its journey to becoming a visible image begins in the developer tank. Always remember that the developer is always the first chemical step in film processing. Question 21. Which type of personal protective equipment, PPE, is designed to protect the dental assistant from airborne contaminants and aerosols generated during dental procedures? A. Utility gloves. B. Face shield. C. Surgical mask. D. Safety glasses. Answer: C. Surgical mask. This question tests your fundamental knowledge of infection control and PPE. The keywords "protect the dental assistant from airborne contaminants and aerosols" are definitive clues. A surgical mask, or a higher filtration respirator like an N95, depending on the procedure, is specifically designed to filter out particles, including bacteria and viruses carried in aerosols and spatter generated during dental procedures, protecting the wearer's respiratory system. While a face shield also protects from spatter, the mask is the primary respiratory barrier. Utility gloves protect hands from chemicals, and safety glasses protect eyes. For example, before assisting with any procedure that uses a high-speed handpiece or ultrasonic scaler, a mask is always put on. Always remember that your mask is your main protection against inhaling airborne contaminants. Question 22. What is the primary purpose of applying a dental sealant to the occlusal surfaces of posterior teeth? A. To whiten the teeth. B. To fill existing cavities. C. To prevent dental caries in pits and fissures. D. To strengthen compromised tooth enamel. Answer: C. To prevent dental caries in pits and fissures. This question tests your fundamental knowledge of preventive dentistry procedures. The keywords primary purpose of applying a dental sealant and occlusal surfaces of posterior teeth are crucial. Dental sealants are thin, plastic coatings applied to the pit and fissure surfaces, grooves, of primary and permanent molars and premolars. Their main purpose is to prevent dental caries, cavities, by physically sealing off these susceptible areas from food particles and bacteria, which often get trapped there. They do not whiten, fill existing cavities, or primarily strengthen enamel, but rather act as a protective barrier. For example, a sealant is like a clear rain jacket that keeps food and bacteria out of the deep grooves on a child's molar. Always remember that sealants are all about preventing cavities in those tricky chewing surfaces. Question 23. A patient with a history of asthma reports feeling short of breath during a dental appointment. What is the most immediate action the dental assistant should take after notifying the dentist? A. Administer a bronchodilator, inhaler, if the patient has it. B. Lay the patient completely flat, supine position. C. Offer a glass of water. D. Provide a blanket for warmth. Answer: A. Administer a bronchodilator, inhaler, if the patient has it. This question tests your critical response to a common medical emergency in the dental office. The keywords history of asthma, short of breath, and most immediate action after notifying the dentist are crucial. For a patient experiencing an asthma attack, the most immediate and effective intervention is to administer their prescribed bronchodilator, rescue inhaler, to open their airways. Positioning the patient comfortably, often upright, administering oxygen, and then supporting them through the attack are key. Lying flat can worsen breathing. For example, if an asthmatic patient starts wheezing, you would quickly grab their inhaler to help them breathe easier. Always remember that for an asthma attack, the inhaler is the fastest way to help them breathe. Question 24. Which method of sterilization relies on high-pressure saturated steam to kill microorganisms? A. Dry heat sterilization. B. Chemical vapor sterilization. C. Ethylene oxide sterilization. D. Autoclaving. Answer: D. Autoclaving. This question tests your fundamental knowledge of sterilization methods. The keywords method of sterilization and high-pressure saturated steam to kill microorganisms are definitive clues. Autoclaving is the most common and effective method of heat sterilization in dentistry. It uses high-pressure saturated steam at specific temperatures and times, e.g., 121 degrees Celsius or 132 degrees Celsius, to kill all microorganisms, including bacterial spores. Dry heat uses dry heat, chemical vapor uses chemical vapors, and ethylene oxide is a gas sterilization method. For example, most instrument packs in a dental office are placed into an autoclave for sterilization after cleaning. Always remember that autoclaving means using steam under pressure to sterilize. Question 25. What is the primary function of a prophy cup, rubber cup, used during a coronal polishing procedure? A. To remove hard calculus deposits. B. To apply topical fluoride. C. To remove plaque and extrinsic stains from enamel surfaces. D. To measure periodontal pocket depths. Answer: C. To remove plaque and extrinsic stains from enamel surfaces. This question tests your fundamental knowledge of preventive dentistry procedures and instruments. The keyword primary function of a prophy cup, rubber cup, use during a coronal polishing procedure is crucial. The prophy cup, typically used with an abrasive polishing paste, is designed to remove soft plaque, food debris, and extrinsic, surface, stains from the enamel surfaces of the teeth. It is a cosmetic procedure and part of a professional dental cleaning. It is not designed to remove hard calculus, that's scaling, apply fluoride, that's a separate step, or measure pocket depths, that's a probe. For example, after scaling, the hygienist uses the rotating prophy cup with gritty paste to make your teeth smooth and shiny. Always remember that the prophy cup is for polishing away surface stains and soft plaque. Question 26. Which component of the X-ray machine is responsible for limiting the size and shape of the primary X-ray beam to reduce patient exposure? A. Filament. B. Anode. C. Collimator. D. Timer. Answer: C. Collimator. This question tests your fundamental knowledge of X-ray machine components and their role in radiation safety. The keywords limiting the size and shape of the primary X-ray beam and reduce patient exposure are definitive clues. The collimator is a lead diaphragm, typically positioned at the end of the position indicating device, PID, that restricts the size and shape of the primary X-ray beam. This ensures that only the necessary area is exposed to radiation, minimizing scatter radiation and significantly reducing patient radiation dose, aligning with the Alara principle. The filament creates electrons, the anode produces X-rays, and the timer controls exposure duration. Always remember that the collimator is like a shield that narrows the X-ray beam, protecting the patient from unnecessary radiation. Question 27. What is the purpose of the harpoon on a local anesthetic syringe? A. To attach the needle securely. B. To hold the anesthetic cartridge in place. C. To engage the rubber stopper of the cartridge for aspiration. D. To inject the anesthetic into the tissue. Answer: C. To engage the rubber stopper of the cartridge for aspiration. This question tests your detailed knowledge of local anesthetic equipment. The keyword purpose of the harpoon on a local anesthetic syringe is crucial. The harpoon is a sharp, barbed projection located on the piston rod of an aspirating syringe. Its function is to firmly embed into the rubber stopper at the end of the anesthetic cartridge. This allows the dentist to pull back on the thumb ring and create negative pressure, aspiration, checking to ensure the needle tip is not in a blood vessel before injecting the anesthetic. Always remember that the harpoon lets the dentist aspirate, which checks for blood vessel entry. Question 28. Which of the following is considered an ethical obligation for a dental assistant when documenting patient care? A. Recording only positive aspects of the patient's visit. B. Omitting sensitive patient information for privacy. C. Documenting all treatment accurately, completely, and objectively. D. Using abbreviations and shorthand to save time. Answer: C. Documenting all treatment accurately, completely, and objectively. This question tests your understanding of ethical and legal obligations in dental documentation. The keyword ethical obligation for a dental assistant when documenting patient care is crucial. Accurate, complete, and objective documentation of all patient care, including diagnoses, treatment plans, procedures performed, patient reactions, and communications, is a fundamental ethical and legal requirement. It ensures continuity of care, protects the patient, and serves as a legal record. Omitting information or using unapproved shorthand can lead to miscommunication and jeopardize patient safety and legal standing. For example, every step of a filling procedure, from anesthetic to material placement, must be clearly and factually noted in the patient's chart. Always remember that complete and accurate charting protects everyone involved in patient care. Question 29. What is the appropriate management for a patient experiencing syncope, fainting, in the dental chair? A. Administer oxygen and aromatic spirits, then sit them upright. B. Place the patient in an upright position and offer juice. C. Place the patient in a supine position with feet elevated, then loosen tight clothing. D. Immediately call emergency medical services, EMS. Answer: C. Place the patient in a supine position with feet elevated, then loosen tight clothing. This question tests your critical response to a common medical emergency in the dental office. The keywords appropriate management for a patient experiencing syncope, fainting, are crucial. Syncope, or fainting, is usually caused by a temporary reduction of blood flow to the brain. The most appropriate immediate action is to place the patient in a supine position, flat on their back, with their feet elevated slightly. This helps restore blood flow to the brain. Loosening tight clothing also aids circulation. Administering oxygen may follow, but getting blood to the brain with positioning is the first priority. For example, if a patient suddenly feels dizzy and passes out, quickly recline the chair fully and raise their legs. Always remember that for fainting, lay the patient flat and raise their feet to get blood flowing to the brain. Question 30. Which anatomical structure is a small, soft tissue pad located distal to the mandibular third molar, which is a crucial landmark for mandibular denture impressions? A. Retromolar pad. B. Maxillary tuberosity. C. Mental foramen. D. Genial tubercles. Answer: A. Retromolar pad. This question tests your detailed knowledge of mandibular anatomy, particularly relevant to prosthodontics. The keywords small, soft tissue pad, distal to the mandibular third molar, and crucial landmark for mandibular denture impressions are definitive clues. The retromolar pad is a triangular-shaped soft tissue area located just distal to the most posterior mandibular molar. It is a critical landmark for the retention and stability of mandibular complete dentures, as the denture base must extend to cover this area adequately. The maxillary tuberosity is in the upper jaw, and the mental foramen and genial tubercles are bony landmarks. For example, a well-fitting lower denture will extend back to cover the retromolar pad, which helps prevent it from rocking or lifting. Always remember that the retromolar pad is that soft spot behind your last lower molar that's important for denture fit. Question 31. What is the main reason for using a curing light in increments when placing a large composite restoration? A. To achieve different shades within the composite. B. To reduce the amount of bonding agent required. C. To minimize polymerization shrinkage and heat generation. D. To ensure adequate adhesion to the enamel only. Answer: C. To minimize polymerization shrinkage and heat generation. This question tests your detailed knowledge of composite placement techniques and their underlying material science. The keywords main reason for using a curing light in increments and large composite restoration are crucial. Composite resins undergo polymerization shrinkage. They get slightly smaller as they harden. Placing and curing composite in small increments, layers, helps to significantly minimize the overall stress from this shrinkage, reducing marginal gaps, internal stress on the tooth, and potential postoperative sensitivity. It also helps control heat generation. It does not primarily affect shade, bonding agent amount, or adhesion only to enamel. For example, when filling a large cavity, the dentist will add and cure small portions of the material one at a time to prevent the filling from pulling away from the tooth. Always remember that incremental curing is done to control and reduce polymerization shrinkage and heat. Question 32. Which of the following is a common sign of acute, sudden, inflammation in the gingiva? A. Pale pink color. B. Firm, stippled texture. C. Bleeding upon probing. D. Knife-edged margins. Answer: C. Bleeding upon probing. This question tests your foundational knowledge of periodontal health and disease. The keywords common sign of acute, sudden, inflammation in the gingiva are definitive. Bleeding upon probing, BOP, is one of the earliest and most common clinical signs of gingival inflammation, gingivitis, or periodontal disease. When the gingiva is inflamed, the blood vessels are engorged and more fragile, making them susceptible to bleeding even with gentle probing. Healthy gingiva is typically pale pink, firm, stippled, and does not bleed upon probing. For example, if the hygienist gently probes your gums and you see blood, it's a sign that your gums are inflamed. Always remember that bleeding upon probing is a key indicator of gum inflammation. Question 33. What is the most common route of disease transmission in a dental office without proper infection control? A. Direct contact with contaminated instruments. B. Airborne transmission of aerosols. C. Droplet transmission from coughing/sneezing. D. Indirect contact with contaminated surfaces. Answer: D. Indirect contact with contaminated surfaces. This question tests your critical knowledge of infection control and disease transmission routes. The keyword most common route of disease transmission in a dental office without proper infection control is crucial. While all options represent potential routes, indirect contact with contaminated surfaces, e.g., touching a contaminated light handle with bare hands, then touching a clean surface, is considered the most common way pathogens can spread in a dental setting if disinfection protocols are not meticulously followed. Direct contact, airborne, and droplet are also risks, but indirect contact is often subtle and widespread. For example, if a dental assistant touches a contaminated chair button without gloves and then touches a clean patient chart, they could spread germs. Always remember that contaminated surfaces are the silent spreaders if not properly disinfected. Question 34. What is the primary purpose of a diagnostic cast, study model? A. To be used as a permanent restoration for a patient. B. To fabricate custom impression trays. C. To analyze the patient's occlusion and plan treatment. D. To send to the dental lab for crown fabrication. Answer: C. To analyze the patient's occlusion and plan treatment. This question tests your fundamental understanding of dental procedures and materials. The keyword primary purpose of a diagnostic cast, study model, is crucial. A diagnostic cast, study model, is a replica of a patient's dental arches, usually made from gypsum. Its main purpose is to allow the dentist to analyze the patient's occlusion, bite, tooth alignment, existing restorations, and surrounding tissues outside the mouth. This static model is invaluable for treatment planning, patient education, and fabricating other appliances like custom trays, but it's not a restoration itself or directly sent for crown fabrication. That's typically a final impression. For example, a dentist might use study models to show a patient how their teeth will look after orthodontic treatment. Always remember that study models are your 3D map for planning treatment. Question 35. When taking a panoramic radiograph, if the patient's head is tilted upward, chin too high, how will the resulting image appear? A. The maxillary incisors will appear blurred. B. The condyles will be positioned superiorly. C. The mandibular incisors will appear elongated and out of focus. D. The exaggerated smile line will be visible. Answer: C. The mandibular incisors will appear elongated and out of focus. This question tests your understanding of common positioning errors in panoramic radiography and their visual consequences. The clue patient's head is tilted upward, chin too high, refers to an error where the Frankfurt plane, a line from the eye socket to the ear canal, is angled too high. This specific error results in the mandibular incisors appearing elongated and often blurred or out of focus. Conversely, a chin-down position causes an exaggerated smile line and foreshortening of mandibular incisors. Knowing how positioning errors affect image quality is crucial for identifying and correcting them. For example, if a panoramic image shows the lower front teeth looking stretched out, you would recognize the chin was too high. Always remember that a chin-up error leads to elongated lower incisors on a panoramic X-ray. Question 36. Which of the following is considered the safest and most common way for a dental assistant to recap a local anesthetic needle after use, if necessary? A. Two-handed recapping technique. B. Breaking the needle before recapping. C. Using a one-handed scoop technique or a recapping device. D. Bending the needle tip into the cap. Answer: C. Using a one-handed scoop technique or a recapping device. This question tests your critical knowledge of Sharp's safety protocols. The keywords safest and most common way for a dental assistant to recap a local anesthetic needle after use, if necessary, are crucial. The Occupational Safety and Health Administration, OSHA, strongly recommends against two-handed recapping because it poses a high risk of Sharp's injury. If recapping is unavoidable before disposal, the one-handed scoop technique, using the needle to pick up the cap from the tray, or using a mechanical recapping device are the safest methods as they keep both hands away from the needle tip. Needles should never be broken or bent. For example, after an injection, the assistant would place the cap on the tray and use the needle to scoop it up into the cap without using their other hand. Always remember that the one-handed scoop or a recapping device is the safest way to recap. Question 37. A patient develops localized redness and swelling around a recent restorative site. This reaction, occurring hours after exposure, is most likely a sign of what type of allergic response? A. Anaphylaxis, type 1 hypersensitivity. B. Contact dermatitis, type 4 hypersensitivity. C. Vasovagal syncope. D. Generalized urticaria. Answer: B. Contact dermatitis, type 4 hypersensitivity. This question tests your critical knowledge of different types of allergic reactions and their typical presentation. The keywords localized redness and swelling around a recent restorative site and occurring hours after exposure are key clues. This pattern is characteristic of contact dermatitis, which is a type 4, delayed, hypersensitivity reaction. Unlike immediate anaphylaxis, type 1, contact dermatitis manifests hours or days after exposure and is confined to the area of contact. Vasovagal syncope is fainting, and generalized urticaria, hives, is widespread. For example, if a patient gets a red, itchy rash on their skin where a new dental material or an adhesive touched them, and it shows up a day later, that's likely contact dermatitis. Always remember that localized, delayed reactions often point to contact dermatitis. Question 38. What is the primary purpose of placing a glass ionomer liner, not a base, in a cavity preparation? A. To provide thermal insulation and mechanical support. B. To release fluoride and seal dentinal tubules. C. To chemically bond the final restoration directly. D. To increase the overall hardness of the dentin. Answer: B. To release fluoride and seal dentinal tubules. This question tests your detailed understanding of dental materials, differentiating liners from bases. The keywords primary purpose of placing a glass ionomer liner, not a base, and cavity preparation are crucial. A glass ionomer liner is applied in a thin layer to primarily release fluoride, providing a therapeutic benefit against recurrent decay, and to seal the dentinal tubules. Sealing the tubules helps protect the pulp from chemical irritation and reduces postoperative sensitivity. While glass ionomer also has good adhesion and can offer thermal protection when used as a thicker base, as a liner its fluoride release and tubule sealing are key. For example, in a moderately deep cavity, a thin layer of glass ionomer liner might be placed before a composite to give some fluoride protection and seal the dentin. Always remember that glass ionomer liners are great for fluoride release and sealing those tiny dentin tubules. Question 39. What is the primary cause of periodontal disease? A. Genetic factors. B. Smoking. C. Bacterial plaque and calculus accumulation. D. Systemic diseases like diabetes. Answer: C. Bacterial plaque and calculus accumulation. This question tests your fundamental understanding of the etiology, cause, of periodontal disease. The keyword primary cause of periodontal disease is crucial. While genetic factors, smoking, and systemic diseases can all be contributing or modifying factors, the direct and primary cause of periodontal disease, gingivitis and periodontitis, is the accumulation of bacterial plaque, a sticky film of bacteria, and calculus, hardened plaque, on the tooth surfaces, both above and below the gum line. These bacterial deposits trigger the inflammatory response that leads to gum and bone destruction. Good oral hygiene is key to preventing this. Always remember that bacterial plaque and calculus are the main culprits behind gum disease. Question 40. When removing a temporary cement, e.g., temp bond, from a prepared tooth after a temporary crown has been removed, what instrument is typically used? A. Spoon excavator. B. Curette. C. Scaler. D. Composite finishing burr. Answer: A. Spoon excavator. This question tests your practical knowledge of restorative procedures and instrument selection. The keywords removing a temporary cement, e.g., temp bond, from a prepared tooth and after a temporary crown has been removed are crucial. A spoon excavator, with its sharp, spoon-shaped working end, is ideal for gently and effectively scooping or chipping away residual temporary cement from the prepared tooth surface without damaging the delicate tooth structure. Scalers are for calculus removal from non-prepared teeth, curettes are for root planing, and composite finishing burrs are for composites. For example, after the dentist takes off a temporary crown, you would likely use a spoon excavator to carefully clean off any leftover temporary cement from the tooth. Always remember that a spoon excavator is perfect for gently cleaning off temporary cement. Question 41. Which classification of dental caries describes decay that occurs on the occlusal surfaces of posterior teeth, or in the pits and fissures of any tooth? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer: A. Class 1. This question tests your detailed understanding of G.V. Black's classification of carious lesions, a fundamental concept for charting. The keywords Class 1 dental caries and occlusal surfaces of posterior teeth, or in the pits and fissures of any tooth, are definitive. A Class 1 cavity is located in the pits and fissures, which are the natural grooves and depressions on the chewing surfaces of molars and premolars, or in the lingual pits of anterior teeth. These areas are prone to decay due to their morphology. Class 2 refers to posterior interproximal, Class 3 to anterior interproximal, not involving the incisal angle, and Class 4 to anterior interproximal involving the incisal angle. For example, a cavity forming in the main groove on the top of a molar is a Class 1. Always remember that Class 1 means pits and fissures. Question 42. What is the primary function of the high-speed handpiece water spray? A. To lubricate the burr. B. To cool the tooth and burr, preventing pulpal damage. C. To keep the working area visible by rinsing away debris. D. To sterilize the tooth surface during preparation. Answer: B. To cool the tooth and burr, preventing pulpal damage. This question tests your fundamental understanding of dental equipment and its protective functions. The keywords primary function of the high-speed handpiece water spray are crucial. High-speed handpieces generate significant frictional heat during tooth preparation, which can cause irreversible damage to the dental pulp, nerve, if not adequately managed. The constant stream of water spray cools both the tooth structure and the rotating burr, preventing thermal trauma to the pulp. It also helps to clear debris for better visibility. For example, when the dentist is preparing a tooth for a filling, the water spray constantly keeps the tooth from overheating. Always remember that the water spray is crucial for keeping the tooth cool and protecting the nerve. Question 43. Which instrument is specifically designed for interproximal reduction, IPR, or creating space between teeth during orthodontic treatment? A. Howe pliers. B. Band remover. C. Diamond strip, proximal reduction strip. D. Arch-forming pliers. Answer: C. Diamond strip, proximal reduction strip. This question tests your specialized knowledge of orthodontic instruments and procedures. The keywords interproximal reduction, IPR, and creating space between teeth during orthodontic treatment are definitive clues. A diamond strip, also known as a proximal reduction strip or sandpaper strip, is a thin, abrasive strip used to carefully and precisely remove small amounts of enamel from the interproximal, side, surfaces of teeth. This procedure is called IPR and is often performed in orthodontics to create space for tooth alignment or to improve the aesthetics of crowded anterior teeth. The other instruments have different orthodontic functions. For example, an orthodontist might use a diamond strip to create a tiny bit of space between a patient's front teeth to help them align perfectly. Always remember that diamond strips are for carefully creating space between teeth. Question 44. What is the purpose of spore testing a dental sterilizer, autoclave? A. To confirm that the sterilizer is operating at the correct temperature and pressure. B. To verify that all internal chemical indicators have changed color. C. To determine if the sterilizer has successfully killed highly resistant microorganisms. D. To check for leaks in the sterilizer chamber. Answer: C. To determine if the sterilizer has successfully killed highly resistant microorganisms. This question tests your critical knowledge of infection control, specifically sterilizer monitoring. The keywords purpose of spore testing a dental sterilizer are crucial. Spore testing, or biological monitoring, is the most definitive way to determine if a sterilizer is truly effective. It uses highly resistant bacterial spores, e.g., Geobacillus stereothermophilus for steam sterilizers, that are subjected to a sterilization cycle. If these spores are killed, it provides the strongest assurance that the sterilizer is functioning correctly and is capable of killing all types of microorganisms, including the most resistant ones. Chemical indicators confirm exposure, and gauges show physical parameters. Always remember that spore tests are the ultimate proof that your sterilizer is actually killing everything. Question 45. What is the most critical instruction to give a patient regarding fixed orthodontic retainers, e.g., a bonded lingual wire, after orthodontic treatment? A. They can stop flossing the areas around the retainer. B. They need to be worn only at night. C. They are permanent and do not require further dental visits. D. Maintain meticulous oral hygiene, including flossing around the retainer. Answer: D. Maintain meticulous oral hygiene, including flossing around the retainer. This question tests your practical knowledge of post-orthodontic care. The keywords most critical instruction, fixed orthodontic retainers, and after orthodontic treatment are crucial. Bonded lingual retainers are designed to prevent orthodontic relapse, but they can make oral hygiene more challenging. It is absolutely critical for patients to maintain meticulous oral hygiene, including special flossing techniques, e.g., using floss threaders, and regular brushing, to prevent plaque and calculus accumulation around the retainer, which could lead to periodontal problems or decay. They are not worn only at night and still require regular dental checkups. Always remember that even with a fixed retainer, super careful cleaning, especially flossing, is vital to keep teeth and gums healthy. Question 46. Which tooth numbering system is commonly used in general dental practice in the United States, assigning numbers 1 to 32 to permanent teeth? A. Palmer notation system. B. Fédération Dentaire Internationale, FDI, system. C. Universal numbering system. D. Zsigmondy system. Answer: C. Universal numbering system. This question tests your foundational knowledge of tooth identification systems. The keywords commonly used in general dental practice in the United States and assigning numbers 1 to 32 to permanent teeth are definitive clues for the universal numbering system. This system is the standard in the U.S., numbering permanent teeth from 1, maxillary right third molar, to 32, mandibular right third molar, in a continuous sequence. The Palmer and FDI systems are also common but are used differently or in different regions. Accurate tooth identification is essential for proper charting and communication. Always remember that in the U.S., the universal system is your go-to for tooth numbering. Question 47. What is the primary function of a mouth mirror during a dental examination or procedure? A. To hold the patient's tongue. B. To remove plaque from tooth surfaces. C. To provide indirect vision, retract tissues, and reflect light. D. To apply topical anesthetic. Answer: C. To provide indirect vision, retract tissues, and reflect light. This question tests your fundamental knowledge of basic dental instruments. The keyword primary function of a mouth mirror is crucial. The mouth mirror is a versatile and indispensable instrument in dentistry. Its main functions include providing indirect vision, allowing the dentist to see areas not directly visible, retracting the tongue and cheek, to improve access and visibility, and reflecting light onto dark areas of the oral cavity. It is not designed to hold the tongue exclusively, remove plaque, or apply topical anesthetic. For example, the dentist uses the mirror to see the back of your molars, pull your cheek aside, and shine light where needed. Always remember that the mouth mirror is your all-in-one tool for seeing, moving, and lighting up the mouth. Question 48. What is the significance of the term bioburden in infection control? A. The amount of disinfectant used for surface cleaning. B. The number of microorganisms on a surface or object. C. The resistance of bacteria to antibiotics. D. The environmental impact of dental waste. Answer: B. The number of microorganisms on a surface or object. This question tests your understanding of key terminology in infection control. The keyword bioburden refers specifically to the number or amount of viable, living, microorganisms, e.g., bacteria, viruses, fungi, present on an object or surface before sterilization or disinfection. A higher bioburden makes sterilization or disinfection more challenging and requires more stringent cleaning. Understanding bioburden is crucial for effective instrument reprocessing. For example, instruments fresh from a procedure have a high bioburden of blood and saliva, which must be removed before sterilization can be effective. Always remember that bioburden simply means the amount of germs present. Question 49. According to environmental regulations, how should unused, encapsulated amalgam waste be disposed of in a dental office? A. As general office waste. B. In a sharps container. C. In a specifically designated, covered, airtight container for amalgam waste. D. Flushed down the drain with plenty of water. Answer: C. In a specifically designated, covered, airtight container for amalgam waste. This question tests your critical knowledge of hazardous waste management and environmental regulations in a dental office. The keywords in used, encapsulated amalgam waste and disposed of are crucial. Amalgam contains mercury, a hazardous material. Therefore, Any amalgam waste, unused, encapsulated, or extracted tooth with amalgam, must be collected and stored in a specifically designated, covered, airtight container. This prevents mercury vapor release and ensures it is handled by a regulated waste disposal service, in accordance with Environmental Protection Agency, EPA, guidelines. It should never be put in general waste, sharps containers, unless mixed with sharps in a specific amalgam sharps container, or flushed down the drain. Always remember that amalgam waste needs a special airtight container for safe disposal. Question 50. According to CDC guidelines, what is the minimum recommended duration for vigorous hand washing with soap and water in a clinical setting? A. 5 seconds. B. 10 seconds. C. 15 to 20 seconds. D. 30 seconds. Answer: C. 15 to 20 seconds. This question tests your critical knowledge of fundamental infection control practices, specifically hand hygiene. The keywords minimum recommended duration for vigorous hand washing with soap and water and clinical setting are crucial. According to the Centers for Disease Control and Prevention, CDC, and other health organizations, vigorous hand washing with soap and water for a minimum of 15 to 20 seconds, some recommend 20 to 30 seconds, is essential to effectively remove transient microorganisms and prevent the spread of infection. Shorter durations are insufficient for proper decontamination. For example, when washing your hands between patients, you should lather thoroughly and scrub for at least the time it takes to sing Happy Birthday twice. Always remember that 15 to 20 seconds of vigorous scrubbing is the minimum for effective hand washing.